Dr. Burris. Good morning, Dr. Huebner. And I think Tim is, Dr. McBride, sorry. I think Tim's on Zoom.
Yes, yeah.
Okay, good deal. So we've got a quorum. Reverend Duvall is here with me. Can you guys hear me all right? Okay, I will do the best I can. Beautiful day outside, so, and I know that Tim has to leave at 10:30, so we will try to move rather quickly here this morning, but we do have a lot to cover, as always. So let me call the meeting to order. Penny?
Roll call. Dr. McBride. I see him. Dr.
Here.
McBride. Oh,
Here.
fantastic. Reverend Duvall,
Yeah,
of course.
you.
Dr. Garza, no. Dr. Kahn.
Here.
And Dr. Huebner.
Here.
Okay, we do have a quorum.
All right. First item on the agenda is the approval of the August meeting minutes, and I move to approve them. We've all had a chance to review them. Is there any discussion regarding the motion? I'm sorry, is there a second to the motion?
Second.
Any discussion? Hearing none.
Okay, Dr. McBride.
Aye.
Reverend Duvall.
Aye.
Dr. Kahn.
Aye.
And Dr. Huebner.
Aye.
Thank you.
All right. Dr. Burris, this is a little bit bittersweet because it's the last time that we're going to get a presentation from you at these monthly meetings. We can see your finger. We can't see much of your face. I guess you're scrolling to look through your notes to help you here, but thank you for joining us. I know you're in a medical appointment this morning, and so we appreciate you taking some time out to visit and give us an update. Go ahead.
Thank you so much, and I appreciate, I have to tell you, this is really a bittersweet moment for me. I have learned so much from each member of the board. I can't thank you enough. And I've learned a lot about my year in jail. And the fact is that we have some heroic staff that really need support, and I don't think the public fully appreciates the incredible work that they do. Then we also have a group of people in the jail that are not inmates. They are being detained. We have over 900 people in the jail right now, and probably less than 10 are serving a sentence. All the rest are innocent until proven guilty under our Constitution. And they are just, the majority of them are just one opportunity away from succeeding in our community. And it's just paramount that going forward, the jail continues to do everything they can to give those people that opportunity so they can succeed and be good neighbors, parents, and taxpayers. And it's been a real honor to serve in this position. And the memories I'll cherish. And again, I thank each member of the board for the education that they've given me and the support they've given me. And I know that the best days of the jail are ahead. They haven't been over the past years. They're going to be in the coming years. And please support the administration going forward, as I think the jail within a year or two will be the best jail in the country because of some upcoming programming and changes.
Thank you very much, Director Burris. Are you anything else today?
No, I've got about 2 hours here, and then I'm going to do honeydews.
Okay. Well, we, as we said last month, when you announced your retirement, we're very grateful that you came out of retirement in the first place to help bring a new culture to this facility. Goodbye this morning, but not goodbye permanently, and we know you'll be involved, especially during this period Scott serves as interim director to help advise him and getting involved, completing a lot of the reforms that you've initiated. So, thank you. And we wish you luck at your appointment this morning.
Well, thank you so much. And, you know, it's never been about me or one employee, and it's always been about the work. So I'll get off now and let you all complete the work.
Okay. Thank you, and we'll be in touch.
All right. Thank you.
Good day. All right. On to more prosaic items. The financial audit has been kind of nagging at a, you know, it's been going on for months. And I know the last time that we met, they intended to get us this report by late September, I think was the wording.
Right.
Can you give us an update on where things are?
We had a meeting actually yesterday, and they still don't have the final recommendations yet, but it's very close. It could be any day. They will have some excellent recommendations for us, and the legal counsel is on the meeting, so I'd like to consult with them first before we go into any details. James, are you?
Hey, I'm here. What sort of questions did you have? Happy to help.
So, level of detail that we can respond about the status of it?
Well, I think kind of what you said, it's not complete yet, and we don't have a full grasp on what it's going to say. Depending on what's in that report, there may be some issues or some topics that are inappropriate for an open session. And I think it's sort of inappropriate to speculate on what might be in there until we know. So I think as far as, the finality of it, I don't see how we really could talk about it. But that's sort of my 2 cents on the matter.
Okay, well, have they altered their earlier guidance about when we can expect it?
It could be still by the end of the month. It's that close. They're waiting on just a couple of documents. They have all the documentation that they need, but they didn't realize there were some hard copies of things, and I think it's an important part of it. So our view is we want to make sure that they have a chance to look through it all and then give us the response. So I do think that the second we get that, legal counsel has to review that, I understand, in terms of what can be released to the public, and there would be an opportunity for the board to hear that before anything would be released, and there could be a special closed session held if that would be, and we don't want anything that may include personnel, for example. People have a right to privacy.
So you're open to a special board session where
yeah, I definitely think we would prefer to get the results and moving forward, because there's going to be some excellent recommendations. We're already just in the past couple of months have made some big improvements. So it's going to be very helpful information.
Okay. Questions from the board?
Question. Are we paying any additional money for this delay?
No.
Okay, so what is the final contractual price? How much did we pay for this audit?
Is that public record, James?
It's public money.
Yeah, I don't see why that would be.
I don't have any thought on how it was contracted or I'd imagine the final price we won't know until the final report is issued. But and again, I think it's you don't want to discuss finality until there's something final. But
so that's true. The contract is set up as a not to exceed $250,000, and so we won't know the actual price until then, but it will be less than that. So we don't have the invoice from the company, and it's not approved.
So the contract stated it wouldn't exceed $250,000.
Yes.
We know in general that we have some budget woes within this building. How did we pay for something that may go as high as $200,000? Did we
Well-
pay it out of the inmate service fund?
I don't agree that we have budget woes.
Okay, we don't?
No, I don't agree with that. I think we're actually, we have an issue with recruiting and staffing and some issues with overtime, but financially, we're actually doing some very innovative things now that we'll be sharing a little bit later. And I think the challenge for this jail and other jails across the country right now is being able to recruit and retain corrections professionals. But we're in a position now where we'll be able to do a lot. And I think that we have 3 reviews, so I'd like to just address it at one time. These are all important investments to improving the quality of the jail. I would just ask the board for patience. We are very close to having all of this information. It's going to be very helpful.
So the original, as part of the original, I guess, impetus for the financial review, it was uncovered that we were, like, owed a significant amount, I guess, by the feds. Is that right?
We, I think that
This is before you started here.
Yeah. I think in terms of this, collectively, you have a financial review, a per diem review, and an operational review. And there are definitely going to be things that generate revenue for the county and that will help us operate more efficiently. So, and I want to honor the process with cone of silence on some of these things that are not able to be discussed publicly, but I can assure you that all of these are well worth the investment, and if we will be bringing in revenue, not losing revenue.
Okay, so 2 years ago, this board requested this operational audit, which entailed 11 components. One of the 11 components was a financial audit.
Yeah, about a year ago.
Okay, so that meets that, correct?
Mm-hmm.
So when you said the impotence was, and I noticed, Scott didn't really answer that other than he just wants to do the process and the code of silence. I just want some clarity that we didn't ask for the Vera Causa report, but they did one, right?
Yeah.
So I don't know if that then checks off one of the boxes of the 11. And I'm just saying, I'm trying to make sure I get this clear.
Yeah.
Because all this talking that we do, I just want some action. And I get it, we need to be patient. But this financial audit, again, it's money, and I'll disagree that we don't have financial woes. Because if we didn't have financial woes, we wouldn't have been fighting so much to how to get proper pay to address the recruiting issue. We wouldn't have it such high if we had the money, as we keep saying, we needed the money to provide the adequate raises and increases. But that's a whole nother talk show, right?
No,
So-
we do.
So, I'm sorry, forgive me, I'm addressing the chair right now. So, what is it that you think I asked in the email that I sent to you, Doug, and Scott about this financial audit? When was it ordered? Why was it ordered? How much was it gonna cost? And all those things were kind of listed. And I didn't really get a response from that, so now I feel compelled, only because it's on here and we didn't get it, only because they didn't, I just want to know, is it the end of the month, is it, and we don't know that. Is that what I'm hearing?
I would expect it by the end of next week.
So the only thing I would ask respectfully, that they send you, if they haven't already, a correspondence that states that, hey, we're sorry for the delay. I was a little taken aback, Scott, when the statement was made, well, we found some hard copies.
Well, that's an archive.
Well, I thought you just said that the reason they hadn't completed, that they needed to go in and look at some other things.
No, they didn't realize that there were hard copies of things. They just asked the question.
Okay, so they didn't realize that there was.
In a process like this, you get a draft report. And
Okay.
when you see the draft, then you have an opportunity to clarify whether things are available. And we did that, and they said it would be important for them to look at that. So I think the great news here is the council has approved ARPA funding to provide incentives. The Civil Service Commission will be approving those. There will be increases. And just respectfully, we have made some tremendous improvements under the leadership of Director Burris and within the past 2 months since I've been here. So I would have loved nothing more than to have that final report to be able to share this morning. We had hoped we would, and I think we're very close, within a week. And we can, as soon as legal counsel looks at that, this board will be the first to see the results, and we can have that discussion. And I think the per diem review will also be done very quickly before the next board meeting. And we have also some great news about selection of the operational review. So they're kind of all tied together, but the second process that we went through, we had eight very qualified respondents. We selected one. Their contract is being finalized now, and that process could start as soon as next week. That's good news. But, in response to what we requested, last September, with the 11 items, the vast majority of which will be covered in the operational review that you're about to sign the contract on, which is good news. If I can just address briefly the point that you raised, Reverend Duval. Director Burris requested the financial audit, and that was this spring, as I think we all recall, in regard to some kind of surprising news that we got during a board meeting, that there was a significant amount of money that was owed to us by the federal government that had not been adequately invoiced. And so I think that was really the initial impetus for it. And I think upon further investigation, there were other irregularities that were identified. So I think that was the initial impetus for the audit. I think we're all interested to see what it shows, and so thank you for committing to letting us know as soon as you are cleared to divulge the results of the report. And we will hope to hear from you, within the next week on that.
Jeff?
Yes, Tim.
Yeah, if I could just real quickly just agree with Reverend Duval on the point that I was surprised to hear that the jail's not facing financial problems because whatever way it was put, because I think when Director Burris, to his credit, pushed for increases for the staff, there was pushback, I think, from the council saying, there's only so much we can do. And I think we've closed the gap, but not, we've closed some of the gap, but not all of it. So I guess I would be a little surprised to see a message being put out, well, we don't have a financial problem. Well, then why didn't we close the whole gap? So we have to be kind of careful to say if that's really the case. And we also know the health staff's underpaid. So we got a problem there. So if we really don't have a financial problem, well, let's do more then. So I'm a little confused, frankly. I just want to say that.
Okay, I think I think some of the things that can't be shared here today are going to help resolve a lot of the financial issues, the challenges that we've had, and I look forward to being able to share that. We're talking about a substantial amount of revenue that's available, that's not, and we're working on it right now. So I think that when I share that information, that'll help satisfy some of the concerns that you have, and I also think that there's ways that we're saving money now and reducing our jail population that contribute to this as well. But I definitely agree with you in terms of the need to increase pay, and we're working on a plan to be able to do that even further than what's been authorized by the council. I'm looking at it just from my experience here in 2 months, so I'm not privy to all the conversations that the board's had about the history. And but I do think after I have an opportunity to share with you the results and what we're doing, and I'd welcome that just as soon as that information comes in. But this is the largest jail in the state, and we have lost some revenue from losing federal residents, and so that's definitely a big loss.
Who paid a lot more than state detainees.
Right. But some of the per diem reviews will increase the amount that we can bring in from.
So tell us about that.
Well, there's still a cone of silence on this. So I can tell you that the contracts haven't been renewed here for 30 years, and the price that was being paid for that, around $30 per day, is severely under the cost of what the actual cost is, and we'll be able to renegotiate all of those costs. Even the federal contract is substantially less than what the cost is. So this per diem review will give us some ways that we can begin to increase that revenue right away.
Do we have any confidence that the state is going, what leverage do we have to compel them to renegotiate a contract that hasn't been renegotiated for 30 years, I guess is my question.
Everything is actually in the works already. And
okay.
The state has been delinquent on payments, and those are being brought current. That's a big part of the financial challenges that the jail has had, and I'm really happy to let you know that there's a process that will remain current under an order that the governor's issued recently. So I understand completely, and probably I used a poor choice of words to say we don't have a financial problem, but I think compared to where the jail was a year ago to where we are, and based on where we will be shortly, the situation has improved greatly.
Okay, well, I'd like to just keep the per diem review issue and our negotiations with the state. That will certainly be of continuing interest to me because it's, a massive, if we get $10 a day, even more from the state, that's going to have a massive top line effect, on our budget. And if the gap is what I think it will be, just $30 versus $100 and change, that negotiation is going to basically determine everything that we do around here. The result of that negotiation will determine what kind of facility we can run.
Yeah.
So, I'm not sure, so you're involved in that negotiation?
Yes.
Okay.
Yeah. So, and we're not waiting for the results of these reviews to make changes. So but we do. Our plan was to be able to provide the information today, and I've been advised that the policies that are in place don't allow me to do that.
Okay. Okay. Well, we'll keep it on the agenda for next month, and hopefully by then we'll have updates on the financial audit, on the per diem review, and we'll have the results of who will be conducting the operational review. Is that accurate?
Yes.
Okay.
And the agencies that put in the proposals for the operational review have done large jail reviews across the United States, over 300 similar reviews in places like Cook County, Illinois, the largest jail in the country, Los Angeles, Houston, just Philadelphia, just to name a few. So I think we'll be very satisfied with the information that they provide.
Good. That's good to hear. Okay, so we kind of mixed in items 4, 5, and 6 on the agenda. Before we leave those items, are there other questions from the board on any of those? Okay, I know you guys had another job fair recently, another hiring fair recently. Can you give us an update on the results of, kind of the funnel of like how many people, how many people responded, how many people showed up at the fair, how many people got job offers, how many people went into training, and how many people are actually going to start or did start as a result of the fair?
Yeah, and even before that, we had a group from the last hiring event that started training this Monday of this week.
Okay.
And
how many is that?
We had a class of 5, but there are 3 because the other 2 accepted jobs where they were hiring bonuses. And we're competing with people like Amazon that just this week announced a $3,000 hiring bonus and college tuition. So we had a hiring event where there were 20 people scheduled, and only 12 showed up for the interviews that day. And from those 12, we've offered employment for 7. And the plan, we're actually waiting now on approval from the Civil Service Commission for incentives for apprentices, which will provide a $500 hiring incentive for after a probationary period, those apprentices would receive that incentive. And then all staff and those new staff will receive up to 30 hours of college credit at a community college. So that's very near final approval. The county council approved that at the last meeting on Tuesday. And the other incentives that were previously approved, we've gone back to the council to request that some additional staff be included that were initially requested but weren't included in the final legislation. So we're hoping that that will pass next Tuesday, and that the Civil Service Commission can make the necessary approval so that we can begin to utilize those recruitment strategies that are in place. We also are planning to increase the number of the hiring events and training so that we can bring in, right now those are being held monthly, and even though that was an increase from how frequently they were held before, you can go now online and see that we have 3 scheduled and we plan to do more.
And what about on the retention side? Like, we're hiring in little chunks, 3 here, 4 there, 5 there.
Yeah.
What do we look like on the staff?
So we're still down 74 staff, 74 corrections officer positions, and all staff here are assisting, even staff on the administrative side. So as has been suggested, staff and the higher level management positions are also working inside the jail now just to cover shifts. So that is an ongoing crisis. We've had meetings this week with representatives of the MacArthur prison reduction team as well as judges. And
do you want to skip ahead to agenda item 10 and talk about the GPS initiative, since that's closely related to this?
Sure, that's a great idea. So one of the strategies that we have is we have 150 residents that are lower risk, and they're here because they can't afford bond or they can't afford the electronic monitoring fees that were ordered by the court. So we, from a fiscal standpoint, if the cost of GPS is about $3.50 per day compared to estimates of over $100 per day for incarceration. And so we actually had training this week for 5 staff who will be supervising cases, and will pay for the GPS electronic monitoring. And supervise them if the court's willing to release them. So the PRT team for the MacArthur grant have been reviewing those cases weekly, and we're also asking that judges consider cases that they may have incarcerated if they're willing to allow us to supervise them on using that technology. So the reason that we're doing that is it's still, even with hiring, it takes, there's 3 weeks of classroom training and 3 weeks of on-the-job shadowing before they can be able to work a post in the jail. So we have a few months where we need to be able to reduce the jail population until we can get those staff on board. And we haven't been able to advertise the incentives yet because those can't be paid until it all goes through the process with the county council's approval and the Civil Service Commission. So the minute that we have that final approval and we can post that, I think that'll make it, we'll see a huge increase. We also are looking at reducing the age of corrections officers because surrounding jails in the state have reduced the age. So
Is it 21?
currently at 21 with the driver's license required and either some college or prior work experience. And so we are reducing the age to 19 and removing the driver's license requirement. The driver's license is required for some positions, but not all positions. This will be a great thing for us because I'll be sharing some information about the community college providing programming, and they have an associate's degree in criminal justice. And so as students graduate from that program at age 19, they'd be able to come to work directly in the jail.
Okay. That's good. I have 2 questions. The first is, I think you said something to the effect of, given the population here, you've embarked on this initiative with, to have about 150 lower level people who have, who are low risk, lower level offenses, who will then go on home confinement with GPS. I'm hopeful that regardless of the count here, and regardless of the staffing situation, the people who don't really need to be locked up are not locked up, right? So, even if we didn't have an acute staffing shortage, I'm hopeful that these kinds of initiatives will continue.
Definitely, that's been the vision of Director Burris, and I shared that vision. That's why I'm here. I came here to assist with development of that, and I'm just really excited about the progress we've made and seeing that all implemented.
Okay, and my second question, and this may be better addressed to Dr. Huebner. I was just curious about the evaluation process to determine who is eligible for the GPS program. Since I know she's involved.
Sure. Yeah. That would be a small piece of it, Jeff, though.
Okay.
Yeah.
Dr. Huebner?
Well, I'm not, yes, I'm involved in the population review team meeting. I don't design the eligibility for the GPS project. I'm happy to discuss best practices and stuff like that. So that's kind of my role, is always to chat with the group about what other places are doing, what are best practices and stuff like that. I think for the GPS, it has to be agreed on by the whole team. So the prosecutor, public defender, attorney or judge. So that's usually how that's negotiated on a case-by-case basis. But I think Scott's doing a great job. He's really advocated for some innovative things and has reached out to attorney or to judges. And I think it's that sort of collaborative work that's going to make a big difference, or it has already made a big difference in the population. But yeah, I'm always happy to consult about that. But we did just a little shout out really quick to some work we did. We did do an analysis of the population before and after the PRT, and we did find a substantial decline that we were able to document. So I'm glad this work is continuing, and we'll go on for a while.
Yeah, the bail project through the prosecutor's office also has some cases that they were not willing to post bail on, but they would be willing to, if GPS was used with our supervision of them on pretrial. So, and we have pulled a list of people that our pretrial office can also work with, attorneys, prosecutor, and counsel. So we have a three-pronged approach there to identify those cases.
Okay. Okay. Any other questions on, I guess, either agenda item 7 or 10? To cover the vote.
Jeff, so I'm trying to figure out where to put this, since we're sort of picking up agenda items different places, but since this was an update on recruitment, and I know Aaron's going to do his dashboard later. So there were some points that were made about the recruitment to fill open positions. So I was cruising Aaron's dashboard while we were hearing this. I'm trying to figure out how many open positions we have in both the correction side and on the clinical health side. So part of my question is going to be about the clinical health side, and I can hold off on that if you want until we get to the clinical health discussion if you want, but I was trying to figure out, because on the clinical health side, it looks to me, unless I'm reading it wrong, that there's about 25% of the clinical FTEs are open and not filled, if I'm reading Aaron's dashboard correctly. I don't see a number of open correctional positions on Aaron's dashboard, but maybe you can point that to me later or now. But I think the other point I want to make is, you made the point about other places, like I think you said Amazon or whatever was offering incentives, and we couldn't compete with the incentives. And as we know from the council, the way they dealt with the salary proposal was to put some of it into salary and some of it into incentives. So that kind of makes the point that we're kind of running up against a moving target. If we're trying to raise salaries and others are doing the same thing and they're offering even bigger incentives, I just want to make that point that our challenge is still there.
Dr. McBride.
Yeah.
The raw number of the open positions for corrections medicine is 13. I know I put the percentages on there, but it's, yeah. And as Scott said, it's 74 for the correctional officers. The displaying and we can talk about this more on the dashboard, but displaying the historical record of the ups and downs in the number of open positions on the CO side is actually pretty difficult in terms of data availability.
So you're saying 74 on corrections and 13 on health?
Correctional officers. Yeah, I don't know about, maybe management. I don't know if that's included, but yeah.
Thank you.
Sure.
Jeff, I forgot to mention something else.
Okay, go ahead.
We also just were approved to increase the starting pay for officers to $18.18, which is the rate that they would have been moved to after their probationary period, so they'll be able to start at that rate.
And exactly how long is the probationary period?
6 months, as long as they complete it successfully, and there could be an extension if not. But that although it's just about 54 cents higher, is somewhat of an increase in addition to the $500 hiring incentive that the council has approved, and the $500 that the Department of Labor will be funding for apprentices. That'll give us a good incentive for hiring, and then in terms of the existing staff, the milestone increases I think will help as well. And the goal of this
It's a lot of little things.
Yes, and there are other incentives that we passed out at the last meeting that were attached to the minutes. I didn't want to review all of that again, but we do have significant incentives for veterans, like up to $2,400 housing credit. So we have a lot that's available once we get that final approval to implement that. And we expect that, again, this Tuesday, very, very quick, yes.
Okay, so that was, items 7 and 10 on the agenda. So why don't we go to item 8, educational programming?
Yeah, this is probably the most exciting thing that's happened since I've been here in 2 months. We have St. Louis Community College that's toured the facility, and we discovered that people that reside in county jails will now be eligible for Pell Grants. And so we reached out to St. Louis Community College and St. Louis University. Both are planning to come in and provide not only college prep, but actual college classes, and as well as educational opportunities for staff. And I had mentioned that up to 30 hours.
So would that be side by side?
No, that would be separate.
Okay.
Yeah.
Okay.
Yeah, so, and we have established a method so that we could have internet connectivity in the jail, which is very, very innovative and will help with college classes. And just last night, I was able to arrange for laptops for people that are participating in the college program. So this is all.
Can you flesh that out a little bit? You said range, does that mean no cost to the facility?
There's no cost to the facility. So the college courses, they're putting together a list of options. We'll be surveying the residents to find out what their interests are. These will be available to both men and women, and there could also be vocational training. We did have a Safe Serve certification program that we held a graduation for just last month, where you were the keynote speaker. There could be a culinary program because of the excellent kitchen facilities we have, and we have agreements with all the large hotels to hire people that are working in the kitchen and laundry and maintenance, since they're already providing that type of service for over 900 residents. The college classes that have been mentioned could be things like math and English, which would be entry-level college classes. But there definitely will also be bridges for people when they leave to be able to continue to enroll and further their education. St. Louis University has been going into state prisons for about 12 years in Bonne Terre, and we helped them establish a college prep relationship with the federal prison in Greenville when I was at the Federal Probation Office. And a group called Caritas, which had donated laptops for people in our college program there, have agreed to do the same here. And those will be available for residents to take home with them when they're released. That's participating in those programs.
That's very positive. That's great. So do you have a timetable for, because obviously universities work on a kind of semester basis, so are you going to spend the next couple months figuring out what the demand is like here and the eligibility for detainees, and then try to start it in the spring semester, or what are you thinking?
Well, some of this will start before the end of the calendar year.
Oh, wow.
And again, this will be at no cost to us, and funding's already in place. We're looking at data now, but Aaron's initial look at this found that less than 20 people had college degrees, and he'll be able to. They had data on about 2/3. They're looking into the other third to make sure that we have all the data. Yeah.
I actually have it pulled up now, Scott, if you want me to run through it real quick.
Sure, thank you.
We have data on about 2/3, educational data on about 2/3 of the population in the jail, and only there are 20 people out of 595. Oh, I'm the presenter. Okay. Can we see this screen? Let me share the screen. All right, can we see this now?
Yeah, we can see it.
Yeah, so we have data on 595 of the 892. This is from earlier this week. And only 20 who have some college experience, and of the 595, only one with a full college degree.
That really shows how important education is to reduce recidivism, and this is going to be fantastic. It's part of the vision that we have to make sure we're creating opportunities and hope for people.
Yeah, there's a RAND Corporation study that I'm familiar with, which is actually like a meta study of dozens of other studies, which showed that for every the levels of achievement that Aaron listed on his table there, for every level that people advance while they're incarcerated, there's a 43% reduction in recidivism. So hopefully we can get a lot of people, they're not, hopefully we don't get too many people a whole nother level, because that means they were here for too long.
Yeah.
But hopefully people can it can whet their appetite, and you said you're going to be putting in place, a pipeline so that people can continue the education when they go home, and that's really, I think, the most important piece of this. So,
and I should have mentioned too, we want to make sure we're not leaving anyone out, because a large percentage of them have dropped out of high school.
Yeah.
So the community college will be providing high-tech classes. We'll tutor people that need help with literacy, and people who haven't been in school for a while. There'll be some classes that can get them acclimated to studying habits again. And St. Louis University even has some plans to develop a daily scheduling and the pods, so that as they're doing things, that they can have some educational experiences, even with things that are happening during their daily routine.
that's good. And then you mentioned for COs as well.
So we have the 30 hours of college credit that all current staff will be eligible for after 6 months, and new apprentices after they complete the apprenticeship program. But the St. Louis University and the community college are both looking at setting up college programming. Missouri State Tech out of Lynn actually has a mobile unit that can be brought in as well to provide classes. So we have several different options there, but we're also looking at providing more flexibility with scheduling, because staff would need time to be able to attend college classes, and we've already started that process. So I mentioned the fact that residents are now eligible for Pell Grants, and that process can take some time. So we have an organization that we've arranged to come in and help people fill out the FAFSA, the most important first step in that whole process, and to look at what other financial aid is there. We have St. Louis University's job fair coming up. We have volunteers coming in next week to help coach, so that they can participate on October 19th. And today,
and when Scott says help coach, they're going to come in and make short videos of the detainees, who get a few minutes to talk about their background, their work experience, their job interests or professional interests, which will then be packaged, and customized sets of videos will be sent to, I think, about 70 different employers in the region who are hiring. And these will be detainees who either have a release date or looks like they're probably going to be released this fall.
Yeah, that's right. Yeah, so we have near 50 on the list to participate, and
That's great.
And today, after this meeting, we have directors from the county's workforce development agency coming in to look at space, because under a $4 million grant they have from the Department of Labor, they'll be providing job readiness training for residents. So we're just really excited about all of the programming that will be implemented, and it should start next month.
Questions?
Jeff, I agree. This sounds like a great initiative, and Aaron, your numbers went up there pretty quick and they were kind of small and hard to read, but I'd love to see that table if you want to send it to me.
I can also
So,
display it as we go through the other data too.
yeah, that's fine. My quick question is, do we have a sense of what, well, maybe we don't, because maybe it hasn't really gone very far yet, but what kind of courses they really want?
And so we want to survey the residents and find out what their interests are, but the community college has an extensive list of courses that are available. We have classrooms on every level, 4 classrooms actually on every level, and because of the grant that St. Louis County Workforce Development has for job readiness training, we'll be able to bring in internet connectivity to those classrooms. And so we also have tablets that we're hoping to have, and we actually have the charging stations now in the building. So we're very close to having the tablets as well, which will be able to load educational material and books on those devices as well. So it's just really exciting. And we'll be the first jail to get this. We're at the top of the list for this Pell Grant. And so there's no doubt we have the best jail in the state.
That's good. And I would assume with the job fair, I'm not familiar with any other correctional facility that is, helping people with interview for jobs while they're still detained. Right. So, that's certainly, I think, a positive step. Okay, any other questions on items 8 or 9 that were just covered? All right, moving to agenda item 11, I don't think Valerie is on. I don't see Valerie here, but Valerie asked if we would put together just sort of a small subcommittee of our board that would contribute thought leadership to her and her team as they considered their own staffing shortage on the corrections medicine side. I asked him to be a part of that, and I'll volunteer to be a part of that. I also visited the staff who has got a lot of obligations over the coming month, but may be available to help starting in November. And so for now, Tim and I will let Valerie know that he and I will be doing what we can to kind of think through some of these issues, and then if there is still a need in November, we may loop you in then, Seth, okay? Okay. All right, let's go to the dashboard, Aaron.
Okay, I'll share. Okay, so a couple things I wanted to bring up on the main dashboard. Good news, the population trend is at least relatively in the right direction over the last couple of weeks. The count as of this morning was 885. That's a little bit lower than it had been in late August, early September, so that's good. I think that does not include the people in intake. I looked earlier this morning, the total number, including the people in intake, was I think it was 899, but that changes, by the hour. But the overall trend in population over the last 3 weeks is more good than it is bad, so that's good news. I wanted to real quickly discuss and preemptively, if anybody had any questions about this length of stay metric, I wanted to mention how we had seen a vast increase in the reported length of stay in August, but I wanted to get out ahead of this question and explain that, I think we talked about this last month or within the last few months. The length of stay metric is only backward looking. So what this does is it looks at the average length of stay for the people who were released within the prior month. So unsurprisingly, this number went way up when we released all of the federal residents because so many of them were long stayers. It went down again after we were done releasing the federal residents, But last month it actually went way up again to over 100 days. I want to reiterate that on a short-term basis, this is not a bad thing. This means that recently we've been letting out a lot of people who were here for a long time. If we see that number continue to climb over and over and over again for 6 months, 9 months, 12 months, then we may know that. Yes, Jeff?
So why did we do it just for relief residents? Wouldn't it be a better gauge of where things are if we did it for everybody?
That is true. There's a couple reasons. The biggest reason is honestly is industry standard. The length of stay metric that is reported among all the sites that are within the MacArthur Grant and the SJC group do it this way. So to match the industry standard, this is the way that we do it. And the secondary reason is that you don't really know what someone's total length of stay is going to be until they're gone, right? So it's I do understand the logic that you're getting at, and once in a while internally we will actually just take a cross section of the population on a particular day of all 800 to 900 people and calculate the average number of days that whole group of people has been in the jail to get the quote unquote real or true length of stay. I'm happy to discuss that more offline if you'd like, but this is kind of both for practical reasons and to match the industry standard. This is the way that we've decided to do it. And the point that I was getting at before was that if we can do it, there is a point at which if this number continues to go up and up and up and up over a long period of time, it is still indicative of an issue. But on a short-term scale, the number being really high for 1 month is actually in some ways a good thing, right? Statistically.
Aaron, could I just jump in on that one? And
Sure.
Jeff, so we've been debating and discussing and scratching our heads over this for a few months now. And I've done research on length of stay numbers over the years in other contexts. And there's a whole lot of literature and survival analysis about this and length of uninsured and so on. And so I get the point you're making about essentially these links would be censored. So another way to get at this, to get at the problem you're talking about without sort of, a way of displaying it, which might help answer the question that Jeff's asking, which I often wonder about as well, is instead of showing a number, like number of days that they link to stay, which I agree would be biased, you could instead show like percent of people who have been in the jail
over 1 year, over 2 years.
Like less than 7 days,
Sure.
7 to 1 month to 6 months, 6 months to a year, over a year, and there's nothing, wrong with that number. So if you actually showed bars or pies or, stack bars or something like that, that would actually be a valid display.
Sure, and that would show something different than what's being displayed here. So it wouldn't be redundant.
So anyways, I just sort of throw that out there because I think it would be kind of interesting for me to know, for example, 15% of, I don't know, whatever the percentages of people have been in there over a year. I'd kind of like to know that.
Well, I think right now the number of people who have been here over 1 year is about 250. If I look,
Okay, whatever the number is.
Yeah, I think we looked it up a couple days ago. We can discuss internally, and I think you make a good point that particular information is not redundant to this particular graph because it's actually showing something different. It's showing something current, whereas this is only showing something that's backward looking. So we'll discuss internally about, and we can also discuss offline with you and other board members about potential additions in that regard.
Yeah, anyways, thanks.
Sure. From the main dashboard, the only other thing that I wanted to cover is that the use of force on a per inmate basis, per 1,000 residents, stayed at about the same level as it was last month.
which is up.
Which is a concern. Which we, given how much it's risen in the last, from the summer. So, I think this is something we're going to continue to be very concerned about.
Yeah, we're all concerned about it, and I think so you see a period there where people were locked down, where they weren't able to come out. The county allowed more people to be released. As we have it now, when we're short-staffed, that limits people's ability to be out as well. I think we're at 50% allowed out now by the county's guidelines. So we have requests in for some options, and we have an increased number of people with mental health conditions as well. But one of the items that we have that's in process is requests for padded cells, so that when people bang their heads on walls and doors, instead of injuring themselves, that they could be moved there where they'd be safe. We have been able to from Veterans Administration for people with veterans, in terms of being able to assist them with some things that weren't available previously. And the state has,
they're sending in therapists that have expertise in PTSD or something, or what?
Well, we have a list now of veterans by floor, and they'll be coming in to meet with veterans by group and individually to address some of those things. Yes, but I think, and we're revising policies now, and part of that will help in terms of options that are available in training. We've arranged for National Institute of Corrections to come in and provide technical assistance and training for the staff, which is greatly needed.
What's the timetable on that?
They said that it would not be this fiscal year, which ends in October, but it would be, the planning is in place, and it should start after the fiscal year, which could be by end of calendar year, possibly. Yeah, and that would include some leadership training as well. We have a large number of supervisors here, but I think we have a very committed staff. A lot of them are working overtime, and so I think that's kind of what you're seeing in the trends there, but I do think that we'll see a reduction. If you look at where it's been in the past, it's not inconsistent to how it was back in 2019.
So what mechanisms, if any, are there in place to look at the use of force incidents and see if the same COs keep coming up in the incident?
Well, I've been looking at this daily now, and have been following up on cases and addressing these through policy changes or things that need to happen. Tony Weaver's been meeting daily with people multiple times. As we become aware of situations or grievances are filed, we're working on those. So we have a person that now will be assigned to coordinate and handle these grievances that has done this in the past. The process has been under Director Vanasco for unit supervisors on each floor to respond to those. So now we'll have, on the tablets, we'll have a grievance form that can be filled out anonymously and emailed directly to this coordinator. That is not part of the security side of the jail. And
who will report to you? Or who?
Yes.
Okay.
And
so out of the normal internal investigation chain of command.
Yes.
Okay.
Yeah. So we're reviewing all of the policies. And I think one of the main reasons that the operational review was requested were some deaths in the jail that had occurred several years previously. And the contractor that will be looking at this will be looking at every single use of force, and they'll be making recommendations based upon them. So while we're looking at those now, they'll be looking historically at all of these. And I think we'll have good information to be able to continue to make improvements.
So I guess my only comment is that, I appreciate all that you said. And I like the idea of some of the policy changes that we've discussed and that you've mentioned. But if a policy change is good, if a certain CO has been involved in, 7 different complaints, given that, the data that we're looking at, is there a particular kind of procedure that, if you get one complaint, okay, when you get your second complaint filed on you, then you come in and you speak to somebody when you get your third complaint filed on you, something like that, because I would assume that there's some patterns in that data.
Yeah, so so when you look at use of force, you'll have some that are assaultive in nature, and then you'll have others where the person was in a cell and potentially causing harm to themselves, and you have so you have a variety of different situations. And what I think, Jeff, we are looking at, just like you're suggesting, I've been pulling that information and looking at it, and and we're also looking at the individual situations that come up. So I think this is when you look at the low point of this curve, it was at the beginning of the pandemic,
Mm-hmm.
and at that point in time, residents were not out in public, so there was a natural dip there because they weren't out in recreational areas together. The increase that you saw in July was when video phones were put in place, and there were several fights related to accessibility to video phones because there needed to be more limitations put in terms of use so that more people could use them. It was something that everyone wanted access to. So we've made some changes there, which I think you will see moving forward. With the tablets themselves, the feedback we're getting from places where these tablets have been implemented is that situations for fights and things of that nature in the jail have been reduced significantly. So the area where we can make other improvements are how we address mental health issues, because we don't want to just put someone with a mental health issue in a restraint chair, for example. And the length of time that someone's in that type of restraint, and what are the options that can be used to address that. So all of those things are being changed now. So yeah, we probably should have mentioned that the operational review will last 6 months because of the thoroughness of it, and we're not waiting until then to make improvements.
Okay. Sorry for the digression. Aaron, you want to move on?
Yeah, sure. Let's go to, so this is everything I wanted to cover on the main dashboard. On the supplemental dashboard, I don't have a lot to cover. Just wanted to mention that video visits are, as Scott was talking about recently, started back up in July, and they're back up to their kind of regular usage, as you can see by the increase in the green bar, like what it was before they got the new video system. So that is that. The overtime hours are still high, but they actually went down from July to August a little bit. Otherwise, I don't have anything to cover on the supplemental dashboard.
Can I ask a quick question, Aaron or
Sure.
Jeff or Scott? So on the overtime hours, I did notice the downtick. And, the pay increase was voted on by the council, and, we advocated for that. So that's all really good news. My question is, when did that go into effect? Has it gone into effect yet?
No, it can't go into effect. The legislation that was passed said within 90 days of the Civil Service Commission approval, and that has not happened yet. So at earliest, it would be just before Christmas, and that's our hope. But by wording of the legislation, they said the first amount would be paid 90 days from the final approval of the Civil Service Commission.
Okay, well, that's useful. I'm gonna want to track that in my own mind relative to that chart. Thank you.
Just
Okay, so-
knowing though it's coming is very helpful. Yeah.
Sorry about that. So just a few other updates. I know I've been mentioning the forthcoming financial metrics dashboard for a while. We do just actually this morning had Tricia and I talked about how we do need to still figure out a solution on one of the metrics before we can display it, because we actually have about a 6 to 8 month lag on the availability of data for that metric, and it's a real crucial one. So we're still trying to figure out how we can display that. Once we do, we will get that up and running as soon as possible. I'm trying to think if there's anything else. Does anybody else have any questions on either of the dashboards or on the tables that involve educational attainment for the 2/3 of the population that we have that data for?
I'm good.
Okay.
Very helpful, Aaron, as always. Thank you
Sure.
very much.
No problem. And we will talk more extensively offline at some point about, I have some ideas already about expanding the length of stay metrics to include an additional window where we can track on a more real basis instead of, a backward looking basis.
I would like that.
With that said, I think I will pass it over to Liz.
Good morning.
Good morning.
Okay, so is that mine, Aaron?
This is yours.
That's good.
Yeah, it's the main one,
okay.
and then I'll do the supplemental one when you're done.
Yeah, well, okay. Really, truly, everything is pretty much normal, I guess you would say. There's not any really true outliers. We did have an increase in safety events from last month, and that is from staff reporting issues that we've had with the lab company coming and picking up labs, getting labs done correctly, reconciling medication in our med room were some of the concerns. A significant portion, like 10 of them, were staffing concerns. Staff reported, they're concerned about our shortage, that sort of thing. But if anybody has any specific questions on any of those categories, I would be happy to answer that. Otherwise, you could go to the next dashboard where it gives more. That's just the statistical data on the conditions of the clients that we are taking care of. And of course, there's not much we can do about that. It's just the data that we're letting you know the type of clientele that we're taking care of. Any questions?
I don't think I have a question about the dashboards and things for your hard work. And I hesitate to add any additional work, but we used to get pretty regular reports on COVID. COVID, testing and COVID positive, negative. And that was during the peak of the pandemic. But as you know, we're at the fourth peak or whatever with Delta. I'm just sort of wondering, I assume you probably have a spreadsheet or chart that you've kept that data.
Yeah, we've done 13,479 COVID tests with 170 positive cases. So yes, we currently have 3 positive cases in the facility at this time.
Which is still, relative to the outside, a pretty darn good number.
Yeah.
So I guess one thing I might suggest, if it's not a burden to you, if it's possible to get that report every once in a while mailed to us, I wouldn't mind.
Okay.
And I think, Tim, just FYI, I think a report's going to be issued next week. It's going to place, basically compare county jails across the state and DSD facilities and their, the measures that they took with regard to COVID and the outcomes. And I think it's going to put the county in a very favorable light.
I'm not surprised, but I'm pleased to hear that that's coming out because, once again, kudos to the health staff and correctional staff and everybody, because, I think the numbers are really pretty remarkable compared to what could have been, and actually what's going on outside the jail.
Okay. Any questions about corrections medicine dashboard?
Jeff, I don't have a question, but I just wanted to add that the CDC just approved booster shots for a wide variety of population subgroups, including incarcerated or group housing. So we will be providing not just COVID vaccination, but we'll be scheduling booster shots for those who have received both doses of the Pfizer vaccine. We will also combine that with a flu vaccine offering to everybody. And those plans are currently underway. We hope to be able to roll them out sometime next week or immediately afterwards.
Yeah. That's good. That's very good news. Do we have the statistics on the uptake for the vaccine inside? Anything?
I don't have it available, but I can get that to you.
Okay, I would be interested in that. And then also, just understanding kind of what I would like to understand better, and maybe you can tell me now, and maybe it's something that you can tell me, in an email after the meeting, just who's been the primary messengers to detainees regarding the vaccine? And if you could tell me a little more just about what the messaging has been like, that would interest me.
Our medical director, Dr. Davis, has gone to all the pods on a regular basis and to explain the vaccine, answer any questions that they may have. And she's gotten some participation as far as people will sign up after having the meetings. On our regular testing, we test on twice a week, regular testing. And the vaccinators will also, we test in the morning and come behind in the afternoon and do the vaccination. They too, during the morning COVID testing, will ask questions, answer questions that they may have. There's signage throughout the facility in regards to the vaccine, and that we encourage everybody to get vaccinated. And it's not just, once every 6 months are we talking about this. This is an ongoing thing. We offer the vaccine at intake, even for individuals that may not continue to reside here, that will leave out in the same day. They too can get the vaccine. And we have vaccinators in intake, and they work hard to try and do a group presentation and hopefully if you get one to volunteer, you have a better shot of getting the rest of them to volunteer, we have found. And so it's an ongoing effort from Dr. Davis and her providers along with the vaccinators. And Molly Johnson is our COVID guru here in the facility. So.
Okay, that's very helpful.
But Molly has the statistics as far as how many have been vaccinated versus how many have not.
If you wouldn't mind sending me that or connecting their knowledge, I'd appreciate it. Okay, thank you. Anything else on the medicine dashboard? All right. New business. Does anyone have any new business? Okay, Penny, were there any email submissions?
There were not.
There were not. Okay, then we will set the next board meeting, which I think Scott has requested that we do the final Friday in October.
That'll give us additional time.
Yeah, which would give us additional time to make sure that we have the results of the financial review, the per diem review, and the operational review. Would that be okay for people to do, that would be October 29th?
It works for me.
Okay, let's plan on October 29th at 9 a.m. And
That's for me too, Jeff, by the way, yes.
okay, great. And if there are any notifications before then regarding the financial audit, then I will let you all know, and Scott will let all of us know. Thanks very much. Everybody enjoy the rest of the day and enjoy your weekend. I never remember, do we need a vote to adjourn?
We'll just go ahead and do it. Dr. McBride,
Aye.
Reverend Duval, Dr. Gar, Dr. Khan,
Aye.
Dr. Hubner,
Aye.
all voted in favor.
Aye, yeah,
And Dr. Smith.
aye. All right, meeting is adjourned. Everyone have a good day.